5:30, so we'll call to order this Monday, March 30th meeting. Carl, give me a roll call vote, please.
Councilmember Remley.
Here.
Ronayne.
Here.
Lunsman.
Here.
Reif.
Here.
Johnson.
Here.
Bunceness.
Present.
Olson.
Here.
Rux.
Here.
Mayor Schoeneman.
Here, please stand with me for the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Take a motion to approve last week's minutes for the meeting of March 23rd and the special meeting 25th.
So moved.
Second.
Motion from Olson and a second from, motion from Rux, second from Olson. All in favor, please say aye.
Aye.
Opposed, nay. Motion does carry. We'll move along to our open forum. I think that's where we will be discussing the COVID-19 virus, as well as ordinances that have been proposed. In order to talk about that, on the line with us, we've got Dr. Falk. Dr. Falk, can you hear us?
Yes, perfectly. Thank you.
Sounds good. We've also got Ashley Erickson. And so why don't we lead off with you, in fact. I'm going to give you, say, 2 to 3 minutes, I think, printed on our sheets here. But the floor is entirely yours. Tell us what you've got, and then if anyone's got any questions, we'll chime in.
Excellent. Thank you, Mr. Mayor and council members, for giving me this opportunity to address you regarding the gravely serious matter of COVID-19. My name is Dr. Alex Falk. I've practiced medicine for nearly 36 years. For the past 4 years, I've specialized in family medicine in Redfield, South Dakota. And prior to that, I practiced for 32 years at Vera St. Luke's in emergency medicine. I think it's wise and prudent to encourage physical or social distancing. That's why I communicated with the mayor yesterday, and today I spoke with Mr. Lander, who kindly allowed me to address the city council via telephone. Again, Mr. Lander, thank you for granting that request. In this day of electronic and virtual communication, I'd like to politely suggest the City Council set a positive example by practicing social distancing and meeting in the future by virtual technology. That's why I'm on the phone today. I strongly feel it would be irresponsible for me to appear in person. I've experienced the preparation for SARS, H1N1, Ebola, and now COVID-19. COVID-19 will be the biggest challenge our nation and the world has faced since World War II. COVID-19 has struck the world and now the United States with a vengeance. It will continue to escalate without implementing severe measures to ensure social distancing. I like to refer to it as physical distancing because in this day and age, social distancing really doesn't occur. I'm pleading with you to please do everything in your power to slow down the spread of this lethal disease. The best possible option would be a shelter-in-place order with the exemption of critical services. That would definitely slow the spread, which will result in many lives saved and will also prevent needless suffering. Responsible citizens are staying home. However, a problem exists when people continue to avoid recommendations of social isolation and go about their daily lives by attending places of recreation such as bars, restaurants, and non-essential businesses. Schools, colleges, universities, churches, sports events have all been canceled. Nonetheless, some people continue to disregard recommendations and mix together in public venues. Allowing that to occur might only facilitate herd immunity and subsequently survival of the fittest, but no one wants to see that. Healthcare is on the front line of this war, and I'm truly dreading the future. If this type of behavior continues, medical facilities, physicians, providers may well be overwhelmed. To prevent this, we need your leadership and the public's help and cooperation to rapidly control the spread of this virus. If you choose to wait or hesitate, please understand there'll be more spread of COVID-19, and the results will affect each and every one of us. There's only one way to stop the spread of this virus, and that's to stay home. You've been given the task of this heavy burden by state government. Before you vote, contemplate the value of human life. Think of your children, your grandchildren, your parents, your neighbors, and please do everything you can to keep them safe. Just imagine the horror of watching a loved one not being able to breathe. Please remember that anything you do early will be deemed too much, and in the future, it'll be deemed too little. It's far better to be too aggressive in preventing this tragedy than to be accused of doing too little to prevent it. Thank you for your time.
Thank you, Dr. Falk. We appreciate it. Next, if Mr. Forkel, if you'd make your way to the podium, make sure that the little green light is on.
It
if
is
you would.
on.
So we can already hear you
All right.
as a result.
Thank you. I appreciate the opportunity to be here and talk with you today. And before I go into the specifics of more the COVID directly related, you all can be proud about the mobilization within our community. I can tell you many industries are coming forward, whether it's to deliver food to the healthcare workers at the bedside or deliver masks, or today talking with a company who delivered what we call Tyvek suits to us and for the caregivers, so they have the proper protective gear as we engage in this. So I take great pride in that aspect of our community that is really coming together. Dr. Falk alluded to this a little bit, but there is a saying right now that our chief medical officer opens up every meeting with, and he says this: everything done before a pandemic is seen as an alarmist. Everything done after a pandemic outbreak is seen as inadequate. And I think that's something really important for all of us to remember about the prep work that is necessary for us in this fight. I want to share with you today that Avera Health, along with many other organizations across the country, have developed analytic tools for this. And our model suggests that we will see a surge the third week of April with peak the third week of May. And that highlights how important the next 2 to 3 weeks are in terms of mitigating the spread of disease. Dr. Falk outlined that very eloquently. If once we get into a situation where it has proliferated to a certain point, there's no longer anything that we can do on the preventive side. Social distancing is the only tool we have. There is no vaccine. If you're a physician like Dr. Falk or any of the physicians, whether you work for Avera or Sanford, quite frankly, you can manage the symptoms or try to manage the symptoms. But beyond that, our number one tool, those communities, those states who have greatly mitigated the outbreak are doing it through social distancing. It's extremely important. And so I just want to highlight for you, today in our state, we are doubling every third day. And our numbers are relatively low today. But when it gets into the heat of the intensity of the outbreak, most of the states, cities, communities have seen that double every day. And so let's take, today we're at 101. So ease of math, let's just say 100. Day 1, 200. Day 2, 400. Then 800, 1,600, 3,200, 6,400, 12,800. So you can see how quickly it can extrapolate. And we all know, we watch the news, we see the communities that are struggling with this. And I have the great opportunity to be a CEO of a healthcare organization, and I will tell you, all the people in my facility, and I include Sanford and Rapid City Regional and Redfield and Britain, they are heroes. And they're scared and they have anxiety, and yet they come to work to say, this is what my oath is, and I'm going to be here for the community. And the only lever we have as a community is social distancing. So why aren't we doing that? Why aren't we doing it to the degree that we can. Many of the businesses have already done so. We know preemptively. The problem with that is if we don't all do it, we're just going to elongate the curve. And we're going to be sitting here in June, not going back to business yet. So I think that's something in this of being appropriately on the front end so that everybody wants to get back to normal life as quick as possible. And I also want to say just two quick comments. I know I don't want to go over my time limit, Mr. Mayor, but social distancing does not mean social isolation. It's important for people to get out and get fresh air and, go for a bike ride if you can. And, oh, by the way, if you know people who are before this would have been classified as a shut-in, let's check in on those folks. I want to highlight the 211 that you can call. Our visits for behavioral health type things have skyrocketed. Let's face it, we all have anxiety. Dr. Falk is right. We have not seen this in our generation, and certainly not on the public health side. We have not seen this. So I would ask of you, as you contemplate ordinances for this, to be as strong as you can around the social distancing. And I know that impacts people's livelihoods. There will be businesses that won't survive this. We know that. And that is awful and that is gut-wrenching. But lives are more important than livelihood. And as you as a body have that responsibility, I understand, I don't take that lightly as well, that people's economic well-being is being impacted. But the one way that we can mitigate loss to life and ensure that our healthcare systems aren't overrun is social distancing. And we've seen that across the globe, both positive and negative, and we're seeing it in our country. And so again, I appreciate the time today, and I would gladly answer any questions, or if you need to move on to other speakers, I'll certainly step aside.
No, I'm sure that there will be several questions for you. First of all, thank you for acknowledging the community preparation. I've been in some of those meetings, in fact, even one next to you, and I would totally agree that more preparatory efforts have been made for this than anything that I've been a part of before, and certainly I would expect more than for an illness that's around the horizon. One question that I've been getting from a lot of people relates to ventilators. It seems to be a big concern of a lot of people. Could you tell us a little bit about ventilators, how they work with this illness, and approximately what your access to ventilators is at Avera?
Sure. Well, we all should understand that all types of medical equipment are finite. And with the world outbreak, the supply chain on the we're seeing it obviously in groceries and other things, but on the medical side is seeing the same disruptions. So if I just listened to the president before we came over here, and just to highlight what Dr. Falk and myself has said about the time being different, he had 6-8 companies up there that all have been remobilized through the Defense Production Act, and we should know that means there's something very, very large occurring within our country, and he is mobilizing multiple different agencies to make more ventilators. So we have 24 ventilators here at Avera St. Luke's. If we social distance and we do all the prep work, I have every confidence in the world that we can manage it, but we have to do the prep work on the front end. So we give our physicians, our nurses, our respiratory therapists, our housekeepers, all those people who are working hard to ensure we're here, we have to give them that fighting chance by social distancing.
Another question that I get a lot that I think you'd be the best man to address is about the testing itself. We get these state numbers. There's 101 positive cases, 3,478 negative cases. Good news, 97% of people that believe they have it, the healthcare system, everyone seems to believe that they have it, do not have it, and only 100 and one of those people do. Tell us a little bit about the testing that goes on here.
I think early on in this, there was a lack of maybe public awareness or education around the fact that most sites our test collection. We get the sample, we were sending it into Peer. How this pandemic started in terms of the frontal fight on this is those samples were acquired and they were sent into the State Department Health Lab for results across the entire country. Both Avera and Sanford now have that capability within our Sioux Falls markets, and that's where, I won't speak for Sanford, but that's where Avera, we are now sending ours into, and we've increased our turnaround time dramatically by doing so. I will caution that the same supply chain disruptions are happening in that area as well. There's not, I know today the president talked about the goal of getting millions and millions of kits out there, and hopefully to the point in time where you could do that just in your own home, and that we can do self-kits. I believe that innovation and capitalism in this country, the companies will get there. They're not there quite today. And so testing remains somewhat limited by the CDC guidelines of where you fall in that terms of your high risk and that sort of thing. And then, again, trying to get the reagents and the materials that you need. Today we're in good shape, but tomorrow you never know when a shipment may not a shipment may not come in.
So the last 2 days, the state appeared to have posted the results for about 500, just over 500 tests per day. Before that, it was 300 for a couple of days. How many of those are in our market, would you say?
On average, we're, and I'm talking about Avera St. Luke's only, we're testing probably in the 20 to 40 range based on low and high water marks. It obviously is variable based on the volume. And I would let, my colleagues from Sanford answer as to how much they make up of that.
Sure. And the last time that we had talked, if a person, they'd get triaged to see whether they had other illnesses first before they would get it, because you couldn't ultimately have influenza A and this, or bronchitis, for instance. Is that still part of the process?
Yeah, Dr. Falk can weigh in as a physician greater than I, but the physicians I talk to say it is unlikely, not impossible, but unlikely that you have both. And so because you have the ability to do more rapid testing around influenza and strep and that kind of family of diseases, there tends to be a respiratory panel like that done first to do those rule outs to see if that's present instead of the COVID-19.
Sure. Has anyone else in the council got any questions for Mr. Forkweiser? Councilman Bunce.
Todd, you talked about Avera's modeling. How does that compare to some of the other modeling out there? Everyone I run across has their opinion
Sure.
on what this is going to do, ranging from no big deal to catastrophe. So can you just talk about the modeling and what do you believe
Sure.
could happen?
Well, there are people far smarter than me who we have 3 physicians along with our analytics team that uses already existing data from other markets that are further along than us, and then taking that to extrapolate and overlay. And what they do is they do from strict social isolation policy to no, and then the numbers cascade out based on that. And we are modeling that we're going to be closer on the side, not necessarily maybe a strict quarantine, but closer on the side of strict social isolate or social distancing rather. And I hope that I could stand in front of any of you in 1 month and we're reopening and we didn't see what many of us in the medical industry are saying we're going to see. And if we do that, it will be because of the work that was done. It won't be because of, by some grace of God, South Dakota was spared, when compared to other states. There's a science to this, and the epidemiologists will talk about that in terms of the properties of how this proliferates so rapidly when compared to any other disease, it's certainly in my time. So I believe we are going to see a surge of cases, but But it is certainly my hope that we have the right social distancing policies in place such that our healthcare system in this community, both of the healthcare systems, can manage that.
Thank you. Councilman Rife has a question.
Yeah, when you talk about social distancing, Todd, can you give us maybe clear parameters as to what that entails?
Well, and it is changing. We need to constantly be looking. We look to the source of truth as CDC, and that in terms of the groups. At Avera, we talk about 6 feet and less than 2 minutes of interaction. That there's sound data to say, if someone is positive and you're 6 feet away and less than 2 minutes of interaction, that you're, I guess the probability of you acquiring that goes down much lower. Small groups, certainly 5 or less is what we say at this juncture. And again, it was common sense. I think it was Dr. Falk that alluded to large group gatherings and that sort of thing, where really it's unintended, but because of how this proliferates and the fact that many people won't get symptoms at all from this, but have the virus, you can see it, spread very rapidly. So those are the types of things that we're talking about, or that we talk to even our own staff when we do need to be around each other to have the hospital run. That those are things that we've put in place.
Councilman Rux has a question for you.
So right now, in the results that came out today, Brown County is up to 3 cases. Now, we don't know if they're in Aberdeen or any of those communities, but going off the fact that some people don't have symptoms or may be what they call asymptomatic, do you feel that maybe there's more actual cases out there that maybe someone didn't rise to the level of A, either being tested, or B, just didn't have the severe symptoms that we're seeing?
Sure. Well, I think clearly the science of this would tell you that, based upon the fact that many people are asymptomatic, they don't have symptoms, and many people, thankfully, most of the data says 80% have relatively mild symptoms and aren't going to require doctor intervention or hospital intervention. So based on that, I think it would be a fair assumption to make that our number is higher than that, just because people aren't either symptomatic or they're self-quarantined saying, hey, I don't feel good, which we obviously, part of that social distancing is when you're sick, stay home. And kind of self-quarantine yourself for the proper amount of days wherever you're at in that episode.
And it seems like you're kind of interchangeably using the term social distancing with the business closure. Like that's the only way that you could see a restaurant operationally
Well, I think
functioning.
if you have the ability to meet the guidelines set forth by the CDC and yet operate as a business, I'm certainly not against that. What I would say is, first and foremost, meet the guidelines as the CDC has outlined for social distancing. I think for many businesses that's very difficult to do, just based on their business model or whatever it might be. I certainly don't want to do undue harm to our business community. But as I said before, this is a public health crisis that the United States has not seen at all. And we're at the front end of it. It came in on the East and West Coast and the South, and it's now kind of in the upper Midwest tier. And we're 2 to 4 to 6 weeks behind other states that we're learning from what to do and what not to do.
All right. Oh, Councilman Bunceness?
I have a couple of questions for Dr. Falk, but
Are you still on the line, Dr. Falk?
Yes, sir.
was Ashley Erickson on the line also?
Yeah, maybe that would be our best bet, in fact.
Then can we come back? I would like to ask a couple questions.
Ashley, are you still with us?
I am.
Okay. Sorry to belabor that so long before putting you on the microphone here. Would you take over from here and tell us kind of your thoughts in the perspective of Sanford for a minute, and then we'll see if there's any questions for you.
Sure. And again, thank you guys for allowing me to join via phone. This is Ashley Erickson. I'm Executive Director here at Sanford Health in Aberdeen. So I want to echo and thank Dr. Falk and Todd for their comments, similar to what Avera has shared, is similar to what Sanford Health is doing. It is a challenging situation that I'm just appreciative that last Wednesday you guys called a special meeting to at least get the dialogue going. And I'd emailed the mayor thanking him for at least having the topic of discussion. It is difficult for all businesses. As Todd alluded to, this is a public health crisis, and it's nothing that we should not take seriously. And now is the time to act because it is moving so quickly. As Todd mentioned, as the numbers go on, it's going to double and triple in the next couple weeks. And if we don't try to put certain things in place now, it might be too late. So again, thanking those businesses of what they're doing. I'm appreciative, but also on behalf of our healthcare sector and all of our employees, they are the front line, and we're just trying to protect them in those roles. Open up to questions.
Councilman Bunceness has one for you.
Well, I have one. Anyone can answer it, but I thought Dr. Falk might be the individual to take it on. I have two. There's this thought that you cannot have influenza A and COVID-19. Is that true at the same time?
I think it's unlikely that you can never say never, and there can be coexisting infections, but obviously given the choice of having influenza A or B and COVID-19, the choice there is obvious. And the real risk with the COVID-19 is the issues with the end organ failure and the long-term morbidity and the significant mortality rate.
So what happens to an individual that has more severe a more severe case, and then following that, have we seen young people? We always hear that this is something that affects the elderly. Have we seen young people impacted by this?
Statistically, the more health problems you have in the older age, the mortality and morbidity will increase. And there's data out there for people that have heart disease or pulmonary disease or diabetes, where you can look at what their risk factors of death are with increasing comorbidity. It will strike severely at any age. As far as the process, it tends to cause sepsis, and then you have an inflammatory cascade that can affect multiple organs. The heart can fail. You can get inflammation of the heart called myocarditis, or the covering of the heart called pericarditis. You can have inflammatory lung disease and pneumonia that's viral and affects the lungs on both sides or bilateral. It can cause kidney failure. It can cause encephalitis or inflammation of the brain or the covering of the brain. The problem is it can be multi-system, and that totally increases the risk of death.
Did you have a second question, Dave?
I think he covered them both.
I do, just to add to what you had said about young people, one of the more recent studies, maybe a week ago, stated that half of the people hospitalized in the U.S. were between 20 and 50. So I think it started that way, that this was, like Dr. Falk outlined, older folks that had other underlying conditions, and it does hit that population very hard. But anecdotally, reading and seeing stories where it equally will hit, folks who at least appear to be otherwise healthy.
Mm-hmm.
Dr. Falk, would you say that the term shelter in place that you use is otherwise known as quarantine, or is there a substantial difference between those?
I think when you use the word quarantine, it implies that the person under quarantine has the disease process or shelter in place equals stay at home. Don't mix with the population. Protect yourself. Don't spread it, because the risk of transmission is greatest by those that have no symptoms or are asymptomatic or have very little symptoms and they don't recognize it. I'm glad I'm not there. Whoever's coughing, I just fled.
I didn't hear that. Was that you, Rob?
I did once.
We can joke about
All right,
it.
you guys, stay on your side.
This simply is terrifying. I would love to be there in person, but it's of no value when we have this type of communication available.
The state's actually looking into it. Right now, there's open meeting laws that require a number of people to be physically present, and it sounds like that's something that's being considered as we speak. So perhaps we'll have our wish by the time this thing rolls over. Councilman Rux, and maybe then we'll move along with our agenda.
Just one last thing. We hear so much in the news about PPE or personal protective equipment, especially for nurses and doctors. Do both our hospital systems feel that they have sufficient equipment to, like I say, I mean, the last thing you want is to have this disease get out and all of a sudden, and you start hearing in the news where healthcare workers start showing symptoms and getting sick, and then you have this further breakdown of not having the people available to care for the people who are sick. Do you feel that in Aberdeen we're fairly well prepared for that?
So I can start from the Avera side, and first off, I want to add many people in the community have come forward and are sewing masks, and a lot, you can get certain furnace filters, have the right balance to them to keep the coronavirus out, that you can sew those in. The ingenuity of people and the collaboration and compassion in this community is something to behold. So again, want to just highlight that. We got an audience with the hospital in Seattle, Washington, their ICU director. We got just a very quick phone call a week or two ago to just get some feedback, and that was he had two main lessons, and that was the number one was take care of your PPE and use it very judiciously. And that's why you've seen across healthcare stopped all outpatient elective procedures, is to maintain that. This was the first week at Avera that we did not get one of our shipments in. It was rerouted to New York. So we feel good about where we are at today, but that can change very quickly if you get an inundation of patients. We also have got approval to use ultraviolet lamps at our new hospital in Sioux Falls in the OR. These ultraviolet lamps that are like robots go into the OR room and kill all the germs. They've figured out a process of how to do that to masks, and that you can do that and then reuse them. So trying to use every innovative process and yet be safe, obviously, for our staff and for the patients that we serve. So today, yes. Tomorrow will depend on how well we mitigate the spread of it in our communities. Almost every hospital we have had dialogue with has had some level of disruption with personal protective equipment.
Sounds good. And
Yep,
sorry, Ashley, go ahead.
Yep.
Sorry about that.
Yep. From Sanford's standpoint, we're working across our health system to prepare and ensure the plans are in place. So we manage the treatment and supplies. Based on our needs, the capacity can change rapidly, just like Todd said. So today, yes, in Aberdeen, Sanford Health is sitting well, but that can change depending on the surge and the number of patients that come in. I also, too, want to thank all the area businesses for generous donations, but also being mindful. We all want to be good stewards of our PPE, and there's nursing home and other healthcare facilities that may need that, which the state health department works closely with all of our healthcare entities to make sure that supplies are being spread out and we're all not just hoarding. So thank you.
Thank you very much, Dr. Falk, Ashley, and Todd for coming in. Appreciate your comments on the matter. And
Thank you for your time.
Thank you.
we'll end this call on our side unless you want to sit in for the rest of this meeting.
I will hang up. Thank you much.
Thank you.
Here's a shock.
Thank you.
And Keela, you didn't want to speak yourself.
Ashley if she needed it.
Sounds great. She did wonderful. Thank you for coming in. Move right along to the consent calendar. Possible approval of items A through C. Can I get a motion to approve our consent calendar items?
Move to approve.
Second.
And a motion from Johnson and a second from Rux. All in favor of approving consent calendar, please say aye.
Aye.
And opposed, nay. Oh, spoke over you there. Councilman Olson, sorry about that. Motion does carry. We'll move right along to new business. Upon further consideration, it sounded like we were going to be tabling this measure and pulling it out upon which time that it seemed most timely.
We do have 5A.
We got 5A.
Yeah.
Oh,
5A first, yeah.
jumping right ahead. I have myself a little bit there. Ordinance, first order of business, will be ordinance number 200303. Carl, you didn't think I was going to table your ordinance by any chance, did you there? Supplementing the 2020 budget for various activities and expenses, possible first reading. Carl, tell us about that.
Thank you, Mayor. This is a housekeeping item. When Parks and Rec receives donation, we put it into a gift fund, and then when they spend it in their normal departments, we move the money from the gift fund to the Parks and Rec fund. This allows for those expenditures with the money that's being collected in the gift fund. So it's really just moving it from one fund to another and giving them the budgetary authority that they need.
Move to approve.
Second.
Got a motion from Remley and a second from Olson. Carl, why don't you give me a roll call vote on that?
Councilmember Remley.
Aye.
Ronayne.
Aye.
Lunsman.
Aye.
Rife.
Aye.
Johnson.
Aye.
Bunceness.
Aye.
Olson.
Aye.
Rux.
Aye.
Mayor Shoneman.
Aye, motion does carry. Next, we've got the ordinance 200304. That's the one I was trying to get at. In fact, we had talked about tabling before the meeting. The new information that's brought to our attention was Senate Bill 191, which prevents us from having to do two readings on these sort of things. And we've done the first reading of the similar ordinance number 1 was taken on Wednesday at the emergency meeting and will be second read on this upcoming Wednesday's emergency meeting.
Move to table until Wednesday.
Second.
Got a motion to table by Remley and a second by Bunceness. Can I do a roll call vote with that? or
Thank you, Mark.
Is that a voice vote thing?
Voice vote down on motion to table would be sufficient.
All in favor, please say aye.
Aye.
Opposed, nay. Motion is carried. That will be tabled. Next, we'll move along to hearing on a new retail on-off wine and cider license for Tiffany Langer LLC DBA Pinned Workshop at 322 South Main Street, Suite Number 2. Approval of the retail on-off license. Can I get a motion for that, please?
So moved.
Second.
Got a motion from Rux and a second from Lunsman. Does anyone have anything to contribute to the dialogue on that license? Otherwise, all in favor, please say aye.
Aye.
Opposed, nay. Motion does carry. Next, we'll move along to the request from the police department to surplus automated external defibrillator for donation to the Boys and Girls Club. Chief McNeil, why don't you tell us about that?
Yeah, so we'd like to continue with surplusing the inventory we have that we're not using. And Boys and Girls Club has made a request to receive one of these defibrillators, and we'd like to surplus one to them.
Move to approve.
Second.
Got a motion from Ronayne and a second from Johnson on that matter. Does anyone have any questions for the chief? We had quite a few questions last time.
We still have some in inventory. I think that was one of the questions. So when people reach out to us, we'll line them up with one and then talk to them about what's necessary to make it operational. So we still have some available if people are interested.
Sounds like 7, I believe, were distributed to the churches before, and there's about 11 remaining at that point. Or was it? So we're down to 10. So if anyone needs any defibrillators, that's good. Did I get a motion on that?
Yes.
I did. All in favor, please say aye.
Aye.
And opposed, nay. That does carry. We'll move along to the bills. The approval list for March 30th, 2020, what you see on your screen. In addition, we've got a late edition ETS Corporation for merchant fees to the amount of $1,750. Can I get a motion to pay these bills?
Moved. Second.
Got a motion from Lunsman and a second from Remley. Carl, would you please give me a roll call vote?
Councilmember Rux,
Aye.
Olson,
Aye.
Bunceness,
Aye.
Johnson,
Aye.
Reif,
Aye.
Lunsman,
Aye.
Renane,
Abstain.
Remley,
Aye.
Mayor Shonneman.
Abstain. Motion does carry. The bills will be paid. Next, we've got the payroll for the period March 15th, 2020 through March 28th, 2020, and the city's share of Social Security, old age, and survivors insurance, retirement, health, and life insurance. Can I get a motion to make
Moved.
the payroll, please?
Second.
Got a motion from Bunceness and a second from, was that you, Olson? Rux. I always mix you guys up. Second from Rux. Carl, give me a roll call vote for payroll, please.
Councilmember Remley,
Aye.
Ronayne,
Aye.
Lunsman,
Aye.
Reif,
Aye.
Johnson,
Aye.
Bunceness,
Aye.
Olson,
Aye.
Rux,
Aye.
Mayor Shonneman.
Aye, motion does carry. Lynn, we've got the city manager's report next.
Okay, thank you. I have one item I'd like to highlight this evening. It came from Rich Coco, the city transportation director. He had a telephone conference last Friday with the U.S. DOT Assistant Secretary of Aviation and Internal Affairs, as well as SkyWest. I just want you aware of the fact that Aberdeen will probably experience a temporary reduction of schedule to one flight per day. And we are probably looking at a 60 to 90 day period of time for the reduced scheduling. Likewise, the U.S. DOT Assistant Secretary of Aviation and International Affairs went on to say that they expect to continue EAS service, which is the service that Aberdeen gets. And likewise, and finally, he stated that there will probably be no consideration of restricting or shutting down air travel, not unless becomes a lack of personnel because of TSA.
I was rather hoping that Rich himself would be here because I've had a ton of people ask about the big jet that sits out at the airport. What do you know about that, Lynn?
They're picking up 3M supplies.
Oh, wow, that's incredible. Does anyone else have anything? Councilman Bunceness.
I would inform the council that come Wednesday night, I will be seriously considering the version that was on the agenda tonight for more restrictive measures. In light of what we heard tonight, I would appreciate, Todd, if you could be here on Wednesday. If we could have Ashley here on Wednesday, I think that would be helpful. Give an update and make, so hopefully we can make solid decisions.
Councilman Ronayne.
Likewise, my position has changed as well, and I think that is the proposed ordinance that I'm going to be asking to put into place rather than the less restrictive one that we have already had first reading upon.
So administratively, did I hear you correctly? You want both versions for Wednesday night on the agenda?
So Rob's tabling motion was to Wednesday,
Okay.
correct?
Correct.
I want to know so we do the proper notice. Yeah, and so to be clear, we will put out an amended agenda for the special meeting on Wednesday.
Sounds good. Anything else before we adjourn?
Move to adjourn.
Second.
Got a motion from Bunceness and a second from Rux. All in favor, please say aye.
Aye.
Opposed, nay. We are adjourned.